I think in general, and this would include my own experience, I think that it's seeking healthcare is really personal. And again, it's about that vulnerability. And so even though you understand that somebody is supposed to be professional and has a code of standards under that profession, the fact that you need to go in and tell your story again, and that describing where you might fit on that LGBTQ spectrum would be conducive to getting the best treatment and care possible. It's sometimes fearful. Fear makes you fearful because it's not always been a positive experience. So I know that for myself, I currently don't have a family doctor in Peterborough because it's just feels too complicated and too much work to have to go through that process. So I had until recently kept my family doctor in Toronto, but I'm currently without a family doctor.
So I started working in this area in 2008 when one person was referred to me from the medical officer of health with a request just to find somebody not necessarily knowledgeable, but who was friendly and open and willing to work with her. And she came with a wealth of information, and I had no knowledge prior. And then I started educating myself, and through word of mouth, quickly grew from that one person to currently about 150 people that I see. Some from Peterborough and a whole bunch from other communities, from North Bay to Ottawa to various other places. Just took it upon myself to educate myself through online resources, and as well as attended some training sessions through RHO. And then, particularly because I do have a full family practice, it was started working with Sheena last year to have her participate in the assessments and management as well.
Yeah, I got pulled along for the exciting ride.
So I was a recent patient at a local hospital here in Hamilton and had surgery. And during that experience, I not only have tattoos, but I have a bit of a different haircut. And I identify as gay, and I'm Aboriginal. And so all of that together, I got lots of side-eye. And it's like, oh my God, you just didn't say that, or you don't have all of those pieces of art on your body, and you're a healthcare professional? Oh, that doesn't even, it doesn't jive. I'm like, yeah, it does, because it's me. So that's a personal example. But the minute that, because my hospital gown was up a little bit and my tattoos started showing, and then I didn't have my legs completely covered, and I have tattoos on my legs. So yeah, side-eye definitely that day, for sure. And yeah, and they even, and I'm an older individual, and they even asked if my parents approved of my tattoos and my haircut and my piercings. I was a little offended that day. But yeah, no, I can't do it that way.